Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our weekly news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and introduce who is on our panel today. We're joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Emmentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We'll open it up to our panel to make brief opening statements, and then we'll take questions from our media who are in attendance. We'll start today with Amarillo Mayor Ginger Nelson. Mayor, how are you today?
I'm fine, Dave. Thank you. And hello, Amarillo. Yesterday, the City Council passed a proclamation that declared March 18th as the one-year anniversary of our first positive test here in Amarillo, and acknowledged that we've had many struggles and challenges. We've had many celebrations in people who have survived COVID, but that we have had many losses as well in the 689 deaths that have affected our community. So March 18th will be a day of remembrance in our city, and the flags at city facilities will fly at half-staff in memory of those people that we've lost, and I think just as importantly, in support of the families who are left behind. We all know someone, and we've all been affected by a loss, a death to COVID. And I think it's important for us to formalize and acknowledge that intentionally. So if you're a family that has lost a family member, please know that we grieve with you, and we acknowledge that you have had a loss, and you'll have a permanent loss, always a hole in your heart for how COVID has affected you and your family. Today is the first day of the effectiveness for the governor's new order. And so we are no longer under a statewide mandate to wear a mask. And I know many of you are excited and happy about that. This is certainly a step back towards life, normal life, as we knew it before COVID-19. It is a time of transition in our city, and things can't return to normal in one instant overnight. And so while we work back through this transition, I just want to continue to ask you, as my neighbors, just thank you for your patience. Thank you for the grace that you're showing. None of these decisions are easy, whether you're a business owner or a leader, perhaps in a school district, a classroom, or a nonprofit organization, and you're now making the decision about how to handle masks in your environment for the people that encounter your clients and your employees. And every place is different. So while we're making this transition, and until everyone in our community can have a vaccine if they want one, thank you. Thank you for having patience. Thank you for having extra respect and showing an extra amount of grace to people that are making these choices, even if they're choices that you or I might not agree with. That's all I have today, Dave. Thank you.
Thank you, Mayor Nelson. Let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you?
I'm well, Dave. Thank you. So as of yesterday, there were a total of 33,274 total cases of COVID-19 here in Potter and Randall counties. 16,986 total cases in Potter County and 16,288 cases in Randall County. We do have a total of 32,129 recoveries, and we're up to 689 deaths here in our community. We do have 456 active cases currently. At the 2:30 report card, Public Health will report additional cases. The 7-day rolling positivity rate is currently at 3%, and the positivity rate at the drive-through testing site is at 20%. The 5-day new case average is currently at 40 new cases per day. Our GA34 hospitalization percentage yesterday was at 4.23%, meaning that 4.23% of all hospitalized patients have COVID-19. Our RAC region is no longer considered an area of high hospitalization, and we are still in status level orange. Our hospitalization and infection rates do remain fragile, and the virus is still here in our community. So it's critical that we continue masking, social distancing, good hand washing, and vaccination when your group is called. The public health drive-through testing site does remain operational, and individuals can call 378-6300 to be screened and directed to the test site. To date, Amarillo Public Health has given 57,942 first doses of vaccine and 31,353 second doses of the total received 97,950 doses. Today, we will be open until 5 p.m., so come see us if you're a healthcare worker, 65 or older, or if you're 18 and older with a chronic healthcare condition, or if you work in a licensed childcare facility, a preschool, primary, or secondary school. If you're in one of those groups, come see us today for your vaccine. We do expect an announcement from DSHS potentially today or later this week where they will be announcing the 1C category. So stay tuned to AmarilloAlerts.com. We will update AmarilloAlerts.com as soon as the announcement is made, and our Civic Center clinic will stand ready to update our operations so that we can serve you in that 1C category. And that is all I have, Dave.
Thank you, Casey. Let's now go to Dr. Scott Milton, Public Health Authority, Texas Tech University. Dr. Milton, how are you?
I'm good, Dave. Thank you. So just want to be clear that I'm not wearing a mask today, but I'm sitting in my office by myself, and I've been fully vaccinated. And as soon as I leave my office here at Texas Tech, I'll be putting back on my mask. And the policy here at the Health Science Center is to continue to wear masks. Certainly we have individuals who are immunocompromised around here. We want to protect them as much as possible. I want to spend a little bit of time here just talking about the CDC guidelines and how they've changed a little bit over the last week. So I'll kind of dive right into that. First of all, what is the definition of someone who's fully vaccinated? Well, there are 3 different vaccines on the market right now. There are 2, the Pfizer and the Moderna, that are actually a 2-dose series. And then there's also the J&J, which is a 1-dose series. You need to be 2 weeks out from the second dose of the Pfizer or the Moderna vaccine, or 2 weeks out from the J&J vaccine to be considered fully vaccinated. And essentially what that allows us to do is allows our body to develop the good, effective immune response that takes about 2 weeks. So that's one definition that the CDC has for those that are fully vaccinated. And so for those that are fully vaccinated, what they have recommended now, or what they are allowing to do with safety, is certainly that you can gather indoors with others that have been fully vaccinated without wearing a mask. So you might think of that as developing a little bit of a vaccine bubble. So that's important. The other thing that they've recommended is you can gather indoors with unvaccinated individuals from one other household without masks, unless anyone in that group has increased risks. And we've talked about over the last year what those risks are. Certainly individuals that are elderly, they have chronic medical conditions, have an elevated BMI, these kinds of things that we've talked about. Another important guideline is that there's no need to quarantine if you're exposed to someone who is positive and you've been fully vaccinated. Certainly you need to monitor for symptoms, and they make an exception unless you're in a group setting, such as a detention facility or a group home, then you would need to quarantine if there was an exposure. They still suggest wearing a mask in public places and around those that are at increased risks, and certainly unvaccinated individuals from more than one household. So there's still significant restrictions there that I think make sense, certainly based on our experience. And certainly they've even suggest continuing to avoid large, medium, or large gatherings. And they're still delaying, ask that we delay domestic or international travel on airlines. So I think these types of guidelines will continue to be updated as we go, as we move forward. And I'll try to help clarify those as time goes on. That's all I have, Dave.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
All right, good morning, Dave. So I am windblown. As you can see, all three of my hairs are out of place today. But I am actually very excited that spring is blowing into the panhandle. Now, as the mayor said, this is a day that people have been eagerly awaiting as we see the reduction in the governor's protective measures. I will admit that I am in the camp that is rather nervous about this transition. So, to me, it's not very dissimilar to my occasional patients who are taking medications for hypertension. And they come in and say, doc, my blood pressure has been looking great recently. So I went ahead and stopped my blood pressure medicines. It's usually no surprise that their blood pressure surges after that. Well, same thing here. I'm a little worried that as we step back from these measures that have protected us and gotten us where we are right now, that we're going to see this virus start to pick on us again. Now, there's been a number of commentaries recently about an expected another surge coming at us. And in all the commentaries, there's a common theme, which is this variant, this B117 variant, which is the UK variant. And what they've been able to see that in communities where this particular variant is, there's a tipping point when it hits about 50% of the prevalence of the virus in that community, meaning that half of the virus is this variant. When this happens, they see surges. And they see that this variant takes over. We know that this particular variant is about 75% more infectious than the virus that we've come to know and love as the original COVID-19. So that's the concern is right now there are parts of the United States where we're at 40% of prevalence of this particular variant. So, most of these commentators are saying within the next 1 to 4 months, we may be to expect basically a surge based on the prevalence of this variant. So as we let our guard down, I think we have to be ready to put it right back up again very quickly if this turns out to be the case in the United States. So let's talk about the numbers in Northwest, and they're great. I have to admit, this is always encouraging. Right now, today we have 13 positive patients in Northwest out of our total of 234 people in the acute hospital. We have yet to hit single-digit positives in the hospital yet, but we keep pushing at it. And we've been about somewhere between 11 and 15 positive patients over the last 2 weeks. That is 2.6% of our licensed beds. Now, right now, we have 47 patients in critical care, only 7 of which have COVID-19. Fantastic. And we're using 11 ventilators today, only 2 of which are being used for people who are suffering from COVID-19. So the numbers look fantastic in that respect. Yesterday, we did 120 outpatient tests. We got 0 positives. Incredible. So we've been really looking good in terms of even our outpatient testing. Right now, we only have 2 staff members who are being quarantined due to exposure or positivity for COVID-19. But I think the most encouraging thing is, here it is March 10th. We have only had 1 individual lose their life from COVID-19 in our hospital in the last 10 days. And say previous months, it was 70 plus in a month. And here we are a third into the month, and only 1 person has succumbed to the virus. All very, very encouraging news. And I would love to see this continue as we hit 0 deaths and go way into the single digits for positivity. Now, with regard to remdesivir, our inpatient medicine, we've treated a total of 729 patients with it. We only have 1 patient currently receiving that medication. And then the bamlanivimab, which is that outpatient antibody we're giving, the city has closed their facility, and we're now moving that back to the hospitals since we've had such a low demand for that. We have about 323 doses still available, and we treated about 177 patients so far with this drug. In terms of our staffing, we have continued to see a slow demobilization of the traveling RAC nurses, and we still continue to use a lot of those nurses in our ICU or in our emergency room, but we will continue to work with the RAC as we try to have those folks go to maybe areas of more need as we stabilize our hospital staff. So in the end, it's been an interesting winter. We've seen obviously the reduction in COVID since about December, and we've seen very little to no influenza and very little to no RSV, telling us that the measures that we have been taking do work in preventing these respiratory viruses. Keep in mind, right now, only 8% of the American population has received a vaccine. That's far too low for us to prevent a resurgence if we see this variant. So I'd ask all of us to continue to do these measures as much as we can. I'm wearing a mask today because at the hospital at Northwest, we're not going to change what we're doing right now in terms of protecting our patients and our staff from this virus. So please understand, if you come to the hospital, we will ask you to wear a mask. We will ask you to keep distancing. And I think the more we can continue to do that in the community, at least for the next few months, the better off we will be in terms of hopefully avoiding any further resurgence. That's all I have. Thank you so much.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
Good morning, David. I'm doing well, thank you. And good morning, Amarillo. We are also equally excited about our declining numbers of COVID patients in the hospital. Today, we've dropped down to 10 total COVID inpatients, which is amazing. I look back in my journal since the beginning of the pandemic, tracking numbers here at BSA and the community, and we haven't been as low as 10 since June 26th of last year. And we weren't there very long. We started to climb back up again gradually from that point forward. So very excited that we only have 10 patients today in the hospital. Of those 10, 4 are in our intensive care unit. And of those 4, 2 of those patients are on the ventilator as we speak today. We've seen dramatic reductions in the patients coming to our respiratory triage center in our ER, and that's been down to about 10 to 20 patients a day with just specific respiratory symptoms, not necessarily COVID patients, but certainly during the height of the pandemic, that was our concern when you presented in that fashion. We at this point are going to deactivate that specific respiratory center. We're still going to have patients carefully screened at triage in our ER and keep them segregated if we have a presumption of COVID-19 infection, but we no longer need to have that separate respiratory triage unit unless our numbers start to go up to higher levels, which we will then reactivate that site. We are also now able to keep all of our intensive care unit patients in our historical ICU. We've not had to go outside of that 48-bed capacity for intensive care patients, and we still have an intermediate care unit that has at least 20 patients, depending upon capacity, depending upon our needs there, which can also flex to higher numbers. Our testing has been dramatically down compared to where we were previously. Month to date in March, we have only at this time about 3.6% of all tests coming back positive. We were about 5%, 5.5% in February, and we were as high as 13% in January. So those numbers continue to drop, which we're very happy to see. As far as our quarantine staff, very few. The number has been less than 5 now for a couple of weeks at least. And of our staff that are quarantined, again, we're seeing a consistent pattern that if you're getting quarantined and you're a staff member, obviously it's either because of an exposure or infection. And usually now it's because someone is infected. And the stats are showing that none of those individuals that are infected in quarantine have been vaccinated. It was their choice to not be vaccinated. So I think that speaks volumes of, again, we're seeing the people that are moving forward with vaccination are getting the benefits of not getting infected, are getting the benefits now of not being quarantined, even when they have an exposure. And obviously our healthcare workers are wearing PPE appropriately and masking, and that's helping us prevent any kind of significant exposure. But the CDC even supports now no need to quarantine those individuals if they're at least 2 weeks out from their completed vaccination series. So again, it's a strong argument, I think, for all of us who are able to get vaccinated based upon meeting the appropriate criteria to really consider why we would not. Again, I think that the safety and efficacy at this point certainly is pointing in the right direction. And we're never going to know all details about any drug or therapy. There's going to be no drug or therapy that has zero risk. If a drug or therapy has zero risk, if someone tells you that, then I would challenge that that's probably an inert substance, then it has no benefit likely. So again, I think that we need to really scrutinize the rationale about why we would or wouldn't be vaccinated. Certainly prioritizing those individuals who are at higher risk, first and attempting to protect that population first, and then moving forward. So hopefully all of us can be vaccinated at some point in the near future. I think that it's important to note too that masking at BSA absolutely will continue. Our senior leadership team, we were unanimously in support of continuing masking. We're a healthcare facility, and in all of our healthcare facilities, we're going to require masking. We're asking our visitors to continue to mask. We're still screening visitors and employees for evidence of infection. It may get to a point where we're able to relinquish some of the screening for those that have been vaccinated if they're asymptomatic, but we're not at that point yet. But as we move forward and we monitor the CDC guidelines, we monitor public health recommendations, and we talk amongst the leaders that are on this panel, we continue to formulate what we think is the most prudent approach to keeping our patient and citizens safe here in Amarillo and also at our facilities. So again, we are very optimistic about where we are right now in 2021. We hope this is going to be a much better year for all of us. We're going to continue to do our part as we get additional allocations of vaccine to attempt to vaccinate as many appropriate patients as possible. But of course, that also depends upon what comes our way at this point in terms of availability of the vaccine. Vaccines plural, I should say. That's all I have today. David, thank you.
Thank you, Dr. Lamentier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
David, I'm doing well. First of all, I'd like to welcome everyone. I'm coming to you from the Dalhart VA Clinic, where we'll be doing some dose 2 vaccinations today. So just real quick on our numbers, we currently do not have a COVID positive patient as an inpatient. And our positivity rate this week is currently 1.2%. Last week, it was a little bit under 1%. And so I think last week and this week, we've only had 3 positive patients tested for COVID. Right now, we have vaccinated over 28% of our veterans that we have in our healthcare system. So that's our entire area throughout the Texas Panhandle and down into the Lubbock communities. And as I mentioned, we're up here in Dalhart, we're doing our dose 2 vaccinations. One other thing we will likely do today is we will do our first Johnson & Johnson or Janssen vaccine dose. We did get a small shipment last week, but right now I'm holding those for our rural CBOCs, such as here in Dalhart, Childress, Clovis, some of our homeless veterans, and for some of our homebound veterans. Those are very difficult to do, to coordinate both doses, and so that's what we're going to do. And then when I get a future shipment in the next 2 to 3 weeks, I look to open up the Johnson & Johnson or Janssen single dose vaccination to our communities out of the Amarillo and the Lubbock VA facilities. As I'm talking about vaccines, I do want to remind all veterans, we are vaccinating veterans of all ages. The VA has given the healthcare facility director the ability to make that determination. And given we have not been filling our appointments with the higher age ranges, we are opening up to all veterans. So if you are a veteran and you want to be vaccinated, please call us so we can set up an appointment. The Amarillo VA is going to have a Saturday vaccination clinic this Saturday, and between about 8:30 and noon, veterans can walk in for that vaccination. So we are doing the Moderna vaccination there. So just want to make that very clear. The other thing we are also vaccinating is approved caregivers of the VA Caregiver Support Program. So if you are a caregiver of a veteran in that program, we can also vaccinate you. And then any spouses that are registered in the CHAMP VA program. Now that would be spouses less than 64, but they have to be enrolled in that program. We would also vaccinate them. Tomorrow we're going to do a teletown hall where I'll go into a little bit more detail, but also explain this. And so that'll be at 6 p.m. tomorrow. So for veterans, look forward to that call, and hopefully you'll be able to stay on the line so we can talk to you. And then the last thing I want to say is I do want to remind everyone it is National Registered Dietitian Day. And so I just want to give a shout out to all the dietitians. And if you always wonder, if you're like me, you probably put on a little bit of weight during this COVID pandemic. I think it was between the pandemic and getting out of the Army and them not making me do PT all the time. But we have a video on our Facebook, one of our dietitians, about how to make a quick, healthy meal. And so look, I would ask to go to our Facebook page, take a look at that video. I got to watch it last night and it's outstanding. Also at the VA clinic, we are going to continue to wear our masks. Number one is we think it's the right thing to do for our staff and our patients. And so when you come to the VA facility, you're still going to be expected to be wearing a mask. Now, we do that because of that safety. Now, we're also a federal facility, and so we are required to do it by the presidential executive order and by VA guidance. And so we will continue to enforce the mask requirement on all of our facilities and within our buildings. And subject to that, I'd like to thank the City of Amarillo for this opportunity to talk to my veterans. Thank you, David.
Thank you, Dr. Gonzalez. Let's now go to City Manager Jared Miller. Mr. Miller, how are you?
Doing good, Dave. Thank you. I want to remind everyone that if you have symptoms you think might be coronavirus, call public 300. The testing site is still open. They will do you over the phone and refer through testing site. If transportation is an issue, we don't want that to be a barrier to being able to either or come to the vaccination center. So if you need transportation to either one of those places, please call Amarillo City Transit at 378-3095. They will schedule a trip to and from to make sure that you have the transportation you need to get tested or to get vaccinated. The Governor's Executive Order GA34, which takes effect today, supersedes a number of executive orders. Primary among those, as far as city operations go, is GA29 and GA32. So now GA34 is the order of the day. In GA34, businesses can operate at up to 100% or fully open, 100% capacity. Also, face coverings are strongly encouraged, but not required, through Executive Order or Governor's Executive Order GA32. The area of high hospitalization, the definition for area of high hospitalization is carried forward from GA32 to GA34, so that still exists. However, right now there are no trauma service areas in the state of Texas that are currently classified as an area of high hospitalization. If that ever did happen in any of our trauma service areas, there would be steps that officials could take to mitigate the growth of cases in those areas. Also in GA34, anybody in providing or obtaining services, everyone is strongly encouraged to use good faith efforts and available resources to follow the Texas Department of State Health Services recommendations for good health and to prevent the spread of coronavirus. Nothing in the executive order precludes a business or other establishment from requiring employees or customers to follow additional hygiene measures, including the wearing of face coverings. And everybody on this call falls in that category. The city, along with all the hospitals and the VA, are requiring employees and guests to continue wearing face coverings when in those facilities. From the city standpoint, we totally understand if somebody does not choose to wear a face covering, doesn't want to. We have ways to provide service curbside through electronic and virtual means. We even have a mobile utility billing trailer that provides services outside. So we have a lot of alternative methods, and we want to make sure that everyone's comfortable and can receive those services in the way they choose. So finally, public schools can continue to operate. They are taking their guidance from the Texas Education Agency. With that said, Dave, I'm more than happy to answer any questions. Thanks.
Thank you, Jared. We're not going to go to questions to our media members who are in attendance. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with David Gay of the Amarillo Globe News. David, how are you today?
I'm good. Good morning, everybody. Excuse me. I guess my first question would be for Casey. I know that West Texas A&M announced yesterday that they were starting to they are going to start vaccinating students and faculty on Friday, and they have a shipment of the Johnson & Johnson one-shot vaccine that they are going to distribute. Is there any word from the state on when, if and when the city will be getting some of that vaccine?
No, we have not been notified of a change in our vaccination allocation. So we certainly expect 5,000 doses of the Moderna vaccine each week. But if we do, we'll certainly let everybody know.
Absolutely. And with that, so the 5,000 vaccines coming from the state, that's being consistent every week?
It has been consistent. Yes, we're really thankful for that.
And do you have the current numbers of how many are left first doses and second doses right now, or as of this morning?
Yes. So we have 6,674 first doses and 5,906 second doses.
Absolutely, absolutely. I think with the GA 34 order, I guess, and with area school districts making the decision on whether or not they're going to require a masking with Amarillo ISD continuing the masking, and then Canyon choosing to make masks optional starting April 5th. Does that change anything, I guess, in the way the public health department approaches those school districts on whether or not they are keeping masks optional or not?
No, so our public health is the same. I think Dr. Milton did a great job outlining that. So if if you're fully vaccinated, there are lots of things to consider when we are doing contact tracing. Masking is one, vaccination is one, your close contacts, how close you are, and your time exposed to an individual who's sick is one. So all of those things will certainly be taken into account. Obviously, we've talked, very long, masks certainly offer that protection and will certainly decrease your potential for quarantine. And so those things are always considered when we do contact tracing. But no, it doesn't change the way that we approach our public health response. We will continue to serve each of our school districts the way we always have, and we will continue to do that.
Absolutely. And I guess the last question that I have is regarding the potential 1C announcement. I mean, is there any indication from the state about what groups what may be considered in that category? I know that they recently announced teachers and educators. I believe it was last week. But is there any indication from the state on what individuals may be included in that 1C category?
No, so I think we'll have to all wait for that announcement. What I do expect, though, is that the announcement would be made this week, and then they'll tell us, the group that's included in that category, and then the start date. So the date that will kick off. And so there'll be a lot of information in that announcement. We'll certainly have all of that available on Amarillo alerts, but I would imagine that they'll put that out in a press release. So I would imagine that our media partners will get that information as well.
Sure. And just a clarification, so you don't expect it to be like the teachers last week where they can immediately start being vaccinated that same day?
I don't expect that. I expect that they will make the announcement as to who is included in 1C and then give us a start date. We're really fortunate here in Amarillo. Our process allows us to be very nimble, but if your process requires appointments or different things, then it takes time to make those adjustments. We're fortunate that it doesn't take that time here in Amarillo. We're very nimble. We can make those adjustments very quickly, but it's not that way everywhere. And so it's nice, I think, that they're giving other providers that time to make those changes.
Absolutely. That's all the questions I have. Thank you, guys. Have a great rest of y'all's week.
Thank you, David. Let's now go to, if I'm not mistaken, Aaron Langston of KAMR Channel 4. Aaron, how are you? Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you today? We will come back to Aaron. Let's go to, if I'm not mistaken here, Matt Kinchla of KVII Channel 7. Matt, how are you?
I'm doing great, Dave. How are you?
I'm good, thank you.
Good. Good morning, everyone. I'll just start off with Governor Abbott's reopening plan it's in effect today. Are we concerned about another spike coming soon here?
I think that, go ahead, sir.
I was just going to say, I think that, we talked a little bit about this last week, and the main concern I had was that, we don't have everyone vaccinated. We don't have enough available vaccine just yet. And so I do have a little bit of concern if people are going to not wear masks as often as they did in the past, that we could get a surge. And the other thing is, and Dr. Weiss has done a good job of talking about the variants. You know, these variants are more transmissible and could potentially change the landscape.
Okay, thank you, Dr. Milton. And have you seen a lot of people not in the current 1A, 1B guidelines trying to jump the line? And what is the policy around vaccinating people who don't necessarily qualify or live here?
No, so, we have really had great patients. And I think that is really speaking the people here in Amarillo and the people who are coming to be vaccinated. We have a great screening process in place, and we ask the screening, and people have been very honest, and if they don't qualify, then we ask them to come back at the time that they called, and people have been very gracious about that and very understanding, because it's important that following those state guidelines. And so we have really appreciated our patients who are helping us to follow those guidelines. As far as residency, one of the requirements to be a hub that we vaccinate people regardless of where they live, and so we're doing that because we are a hub, and so we have agreed to follow all of those requirements. We have to vaccinate people based on their eligibility. So the 1A, 1B, the educator criteria, we have to vaccinate equitably, and we have to use all of the doses each week, and also promptly report the doses administered to MTRAC. And so we're doing all of those things, and one of those pieces is also to vaccinate people regardless of where they live. And so we're doing that as a hub. This is everyone's vaccine, and so we're certainly happy to serve in that capacity.
Okay, perfect. And on that note, we've gotten reports of people flying in from Mexico. Can you confirm that? And if not, where else are these people coming from, and what's the furthest away you guys have heard? And could this hurt the supply?
I can't speak to specific patients. I don't hear those things. I don't hear their stories. We take their address when they get here and then enter that into the MTRAC system. So again, we vaccinate people regardless of where they live, just due to that provider agreement that we have as being a hub. But I think that's, I appreciate your question.
Sure thing. And some people in our newsroom have already been vaccinated, while some have been turned down. Is there a consistency among providers on the protocols and the screening?
I can't really speak to the way that every provider manages that. It's probably a little different the way it's rolled out at different providers' offices and different ways that happens. But we certainly have a screening protocol in place at the Civic Center, and we certainly rely on people to tell us the truth.
Okay, that's all I have. Thank you, guys.
Thank you, Matt. Let's now go to Kevin Welch of News Channel 10. Kevin, how are you today?
I'm good, Dave. Thank you. Casey, can you talk a little?
Let's now go to Kevin Welch of News Channel 10. Kevin, how are you today?
I'm good, Dave. Thank you. Can you hear me now?
Yeah, go right ahead.
Okay, sorry. I pushed the wrong button. Okay, so Casey, can you speak a little bit about the penetration of vaccine effort in groups 1A and 1B so far?
Sure. I think you're referring to what we talked about at council yesterday, is that right?
Yes, ma'am.
Okay. So yes, so we have, and I did that math pretty quickly yesterday during city council. So I also like to, make that disclaimer ahead of time. But so of the people that are in that the eligibility categories right now, we have about 39% who have received their first dose, and right around 27.7, so right around 28% have received are fully vaccinated.
Okay, and then just to be clear, moving forward, do you have a certain goal to reach as far as that before we move to 1C, or is that just up to the state?
So that would be up to the state, and I think that, you know, they certainly don't look at, they're looking at Texas as a whole. So while individual counties and individuals are certainly important, the Texas Department of State Health Service is looking at Texas as a whole. And so we're one piece of that puzzle, and I think a very important, but one piece of that puzzle. But I think it will look like waves instead of like a hard stop before we move to the next phase. And so it would be nice if I could say like, this is the formula, but we're all in this and it's new for everyone. And so we're gonna, you know, it'll look kind of like waves. And so I do expect that announcement, or maybe even, you know, sometime before Friday. And so I think, you know, the state is looking at the data, and that data that I told you is just locally. That's just Potter Randall County. So
Right.
that is not the full state's data. So they're looking at what does the whole state of Texas picture look like, and then making those decisions from there.
Okay. And doctors, are you seeing many patients that have recovered and they're, you know, test negative, so they're not active, but they have long-term symptoms like in hearts or lungs, neurological?
So those types of long-term issues are well described, and certainly I have seen patients that you know, are somewhat chronically injured, you know, to their lungs, et cetera. There's kind of a brain fog syndrome that's well described, and I've certainly seen patients with that issue as well. So yes, I mean, for those who get really sick from this, I mean, there can be some permanent sequelae. And so you need to be careful. You need to protect yourself. You really need to get vaccinated. You know, we vaccinated millions of people now across this country, and it is effective and it is safe. So I think that's the main message that people should hear.
Okay, thank you. Casey, yesterday also you said that in response to some kind of survey about whether we would want the Johnson & Johnson vaccine, that you replied yes. Do you have something in mind about how you might use it?
So we're, you know, our team is still working through that process, but I am under the, I feel like that if there is a vaccine product, that we should not say no to it. Vaccine is life-saving. It is life-changing. Just like Dr. Milton talked about, those consequences of the disease are terrible. And so if there is a vaccine available to us, that we should accept that, and so that we can help protect our community. You know, I read an article yesterday, and one of the is talking about why people are maybe choosing not to be vaccinated, and one of the things was they were afraid of the side effects. And you know, so far we've seen people with sore arms and maybe even a little bit of fever for a day or so after the vaccine, and that pales in comparison to what COVID can do, just like Dr. Milton was talking about. So, you know, I did have a sore arm, and I was so happy to have that sore arm, because I was able to breathe a sigh of relief, that I was protected, and, you know, protecting my family and friends from COVID. And so I think that I wandered away from your question a little bit, but yes, so I think that vaccines are life-saving, and that if there is a product available to us, that we're excited about it.
Gotcha. And Dr. Milton, have you seen any indications of the variants here locally?
No, we haven't seen any documented variants here. Now, that being said, the ability to screen for that is limited, and that's a national issue. So I think the variants are very, very likely here, and therefore, what's the response that we should get? We should get everybody vaccinated, because it's this replication that happens when another individual gets infected and transmits it to another that allows this to continue to spread. So once again, please get vaccinated. I think those variants are here, and just as they are across the nation.
Okay. And Casey, with the numbers down so much, trying to do the contact tracing, I'm sure, is much simpler, but are you down to just using staff members for that?
So we have our same team, and it's the team that is doing the drive-through and the contact tracing and the vaccination clinic. And so I think they're superheroes, really, our public health staff. And so they are doing, we have, the team is kind of split up between all of the different operations. And then if needs support, then they move over there, and then they're able to support each of the different operations. So we still do have some of the BCFS staff and some staff from like the Civic Center and different places, and some temporary staff. So we are still relying on people to augment the main public health staff.
Okay. Excuse me for asking, but what does DPFS stand for?
So it's BCFS, and they are a group out of that works with the state health department, like an emergency response team, like the RAC nurses.
Okay. All right, that's everything. Thank you, everybody.
Thank you, Kevin. We'll give it one more try here. KAMR Channel 4, if it's Aaron Langston, maybe Crystal Martinez. We want to give you an opportunity to ask questions now if you're available. One more time to KAMR Channel 4. All right, thank you. That concludes our news conference for today. This is David Henry. I'm Communications Manager for the City of Amarillo. I want to thank all of our panel members who took the time out to provide this information to our community today. You're much appreciated.